My name is Dr. Terry Chappell, and I'm a family practice doc from Bluffton. I've been at this for a long time. I went to University of Michigan for my medical school education, and then got out and did my internship and turned out in Ogden, Utah, and eventually started teaching classes in natural childbirth with my wife, Bobby, who is a nurse, and learned some of the things you could do without necessarily relying on drugs and surgery. So that kind of got me started, and then I got involved when we moved back to Bluffton. I got involved with an organization that taught chelation therapy, which is a therapy that increases circulation all over the body. And pretty soon I was going to meetings and I went to seminars, and they elected me president eventually. So I was president of the American College of Advancement in Medicine, which is an international organization, and now I'm president of the International College of Integrative Medicine. So I've been involved with this for a long time, and have been fortunate enough to learn from doctors all over the world. Just gave a talk a couple weeks ago in London to physicians from around the world. A good number of them were Chinese, by the way. It was an international conference on integrative medicine about the future of medicine. So that was pretty exciting. But this was one of the presentations that I gave at that meeting in London 2 weeks ago. And it's about lifestyle factors in cardiovascular disease in particular. But I think you'll find it being a little broader than what we usually consider to be lifestyle factors. The first question you ask when you start talking to a patient, many times a new patient, is, what is your family history? Particularly for heart attacks and strokes and cancer. Now, this gives you a clue as to what the patient might be at risk for, but it's not absolute. Some people who have high family history for vascular disease might not have that gene expressed, or they might have lifestyle factors that don't bring it out. And others may not have a family history but are at high risk. But it's a good place to start. For sure, though, anybody who has a positive family history should have an aggressive lifestyle program to try to prevent not only the onset of the disease, but the manifestations of the disease. When we're talking about prevention, you want to prevent a disease from getting worse if you happen to have it, as well as prevent it to start with if you don't have it yet. These are the key factors that I'm going to talk about this evening. Lifestyle factors are a major cause of malfunction, disease, disability, and premature death, clearly. And they have a greater impact than drugs and surgery do. And this is whether you're looking at conventional medicine or integrative medicine, which is kind of the new word for alternative medicine. Integrative medicine really means the best of conventional medicine and the best of alternative medicine combined. So you get the best of both worlds. Attention to multiple factors has the greatest potential to reduce the risk of the disease that we're talking about. And integrative medicine addresses more factors than conventional medicine. It's much broader. The Institute of Medicine reported just recently that behavioral and environmental factors account for 70% of avoidable mortality, could prevent 70% of the premature deaths in this country. That's 435,000 deaths due to tobacco and 400,000 deaths due to obesity and inactivity. Now the deaths due to obesity is rising steadily, and tobacco is kind of leveled off. It's decreased a little bit for men, but increased some for women who started to be liberated and started smoking more a few years, and it's catching up with them. So in a few years, obesity will probably be our leading cause of death. 144,000 deaths are due to poverty in this country. It's a lot more in third world countries. Drugs can lower cardiovascular mortality by somewhere between 5 and 30%, depending on, number one, the severity of the disease, and two, compliance of the patient, how well they follow directions. But if you look at the 5 major risk factors that has been studied, particularly in this article in Circulation in 2006, smoking, obesity, inactivity, moderate alcohol, and a healthy diet, you can reduce the risk of premature death by somewhere between 57 and 62%. So that means that these lifestyle factors are twice as effective as the drugs you might take. Now, the AR study, this is a study called the Atherosclerosis Risk in Communities Study. We have all these fancy names with catchy initials that seem to be the thing to do in research studies lately. But they looked at the same risk factors, and they did not include the alcohol in theirs. But the other 4 they did. And 8.5% of the people that had all 4 of these risk factors that were in compliance. In other words, they exercised, they had a healthy diet, they were not obese, and so forth. Within 6 years, 9.4% of females and 7.4% of the men, 9.1% of the females and 7.4% of the men had switched from not a healthy lifestyle to a healthy lifestyle. And those that had all 4 in compliance reduced their cardiovascular mortality by 35% and their all-cause mortality by 40%. So it was a big improvement. After 4 years, though, those who improved only 3 out of the 4. So in most of the time it was obesity. It was the one that they didn't improve. But if they only improved 3 out of the 4, they did not improve their cardiovascular mortality at all. So it went from 35% down to 0% improvement. And they did improve their all-cause mortality by 25%. So they did have some benefit. But the message is, to have a big input in cardiovascular mortality, you have to do all 4. You can't just do 3. Very interesting study was published in December of '06. It's called the OAT study. And OAT stands for the open artery theory. The idea behind this is that cardiovascular surgery, by opening the arteries after somebody has a heart attack, might improve the survival. That's why they do it. However, lo and behold, the study showed the opposite. What it showed, they had people that had had a heart attack. MI stands for heart attack, myocardial infarction. And the patients were stable. These aren't the people that had it done on an emergency basis, but they had been stable for at least several days. But they were still considered to be high risk. And they had a persistent artery that was totally blocked, totally plugged. And they compared the people that had surgery to open that artery, called angioplasty, and most of them had stents put in, and then continued with cardiac drugs as well, to a group of people who did not have the surgery. All they had was cardiac drugs. And the people who had just cardiac drugs did better, had fewer cardiac events than the ones that had the surgery. As you can imagine, this kind of threw the cardiology community into a little bit of a turmoil, because it was showing that this open artery thesis is not necessarily true.